We are the Association of Nigerian Private Medical
Please, can we put our hands together for our president?
On behalf of the Nigerian private doctors, I hereby welcome you all to the epoch-making event of the first of its kind town hall conversation by the private sector of our economy on our healthcare delivery system. It is heartwarming to see the extraordinary complement of enthusiastic Nigerians in the house. Healthcare is at the root of every human consideration and is about everything and everybody. The greatest measure of a nation's wealth, we say in the AGPMPM, is the health of her people. I wish to extend the gratitude of the private doctors to the government of our President, His Excellency Major General Muhammad Buhari, retired GCFR, for their untiring effort to keep Nigerians healthy. We congratulate the Honorable Minister for Health, Dr. Ehanire Osagie, who has not relented since he took position in the trench in the battle against the COVID-19 pandemic. We congratulate him on his gallant victory over polio. Above all, we congratulate the Nigerian people for their resilience and their patience in carrying on despite the heavy burden that healthcare has remained to them, even in this age and time. I congratulate every Nigerian. As we know, health is a universal need. It is everybody's desire and the number one project of every good government. The health of the individual is so important to him and to society that in the wisdom of the United Nations, it has been classified as a critical fundamental right. Ladies and gentlemen, this is the significance of this gathering. In a special way, I welcome you, our distinguished guests, partners, sponsors, and friends. I welcome captains of industries and their representatives here, leaders and members of the health professions here present. You are welcome. My distinguished colleagues, the heroes of the Nigerian healthcare system, congratulations. Observers, the civil liberties organizations, and their representatives, gentlemen of the press, fellow Nigerians, ladies and gentlemen. Today is a special day in the life of our great association and a day of reckoning for our country's healthcare system. We have invited you here today, especially the organized private sector, with the deliberate intention to recap the ugly experience of our healthcare system and deposit that alien entity on the theater table of your conscience for your critical intervention. We are witnesses to the poor state of our healthcare delivery system that, with all modesty, has eroded very fabric of its foundation and left it suppressed and incapacitated. We are witnesses to the progressive obliteration of the lines of distinction between the primary, secondary, and tertiary levels of care in the healthcare system that has totally collapsed the traditional referral principle that is the ideology behind the step-ladder approach to global best practice. We are witnesses also to the body of healthcare professionals torn apart by a war of misplaced ego, prosecuted at the cost of the lives of innocent Nigerians and at the expense of the health and well-being of the health professions. We have also witnessed incessant industrial action by medical and healthcare workers. We have seen very poor funding of the health system, the poor infrastructure, the poor conditions of service for medical and healthcare personnel in both private and public settings, we have continued to watch helplessly as Nigerians engage in a mass exodus to other countries for medical treatment that has been estimated to cost this country over $1 billion every year. As though prompted by the same malady, doctors and other healthcare workers have continued to leave the country in droves. The home environment has been left near desolate. So serious is this situation that it remains the greatest threat to our healthcare system. The tension is at breaking point, but seems not observed or noticed from the comfort zone of the privileged, especially our leadership. We have witnessed our health insurance scheme grandstand through the years and failing in its envisaged obligations to the Nigerian people. We have seen a neglected private sector of our healthcare delivery system that has left it in a solo struggle and offers no promise beyond the catastrophe that we face in socio-economic scarcity, limitations, minimal performance, and hopelessness. We have also witnessed a general decline in capacity and infrastructure in the yawning gap in our local preparedness that has taken away the spirit of competitiveness from us in the community of healthcare nations. We have witnessed the Nigerian healthcare system that was ranked amongst the top 3 in Africa and the destination choice of the Saudi Arabian monarch and his family in the 80s deplete. It is for these and other reasons that we have assembled this wonderful group today. One of the cardinal objectives for this dialogue is to spotlight the place of the private health sector in the healthcare delivery system or chemistry of our country. They are the inevitable partners of government and should be seen in the light of the huge gap they fill in the system rather than be perceived by government as competitors or treated with disdain. The private sector doctors need to be supported and encouraged to optimize their immense potential for the system. The private sector has demonstrated that it is the present strength of our health system, and yet the future of healthcare delivery in Nigeria resides in the private sector. The best in our country today is in the private sector, despite the near lack of support. All it needs is the enabling environment. May I inform Nigerians and the international community that the health sector of Nigeria, with over 200 million people and a potentially viable economy and a deep natural endowment, is a huge investment location. I therefore call on our businessmen and women, local and international investors, to invest in the health sector and invest in the private sector. Distinguished audience, the Association of General and Private Medical Practitioners of Nigeria, the ADPMPN, the host of the event, is the umbrella body of Nigerian private doctors. We are the largest providers of healthcare in Nigeria, the biggest partners of government, and in the states as well. We are the providers of over 70% of the healthcare needs of Nigeria. Our association is 100 years this year, having been founded in 1921. As part of marking this milestone of our centenary, we have decided to partner with stakeholders and Nigerians to rise to support the efforts of our government to improve the nation's healthcare delivery. We desire this especially to support maternal and child care and temper their very huge mortality rates that have become a moral national burden.